different domains, and that was clearly, a missing gap because we scored lowest in that assessment in adolescent and young-friendly intervention. That is what led us to, start reprogramming for adolescent and young person. That led us to develop the adolescent policy, and of course to also run with the adolescent and TWG that we already have now in existence. And we're also able to set up, like you saw from the video, an interfaith forum. TCI midwife that intervention. We took cues from what Plateau State has done, and then initially that interfaith forum was supposed to help us in providing information to religious adherents in across the different faiths, particularly with family planning intervention. But we have agreed as a state that we're going to use that same pedestal to speak to other health interventions, immunization, antenatal attendance, delivery facilities, and all other health interventions that we have, because we believe religious leaders have a large influence, have a large space, and when they speak from the podium or from the member, the adherents listen to them. And it was a novel idea for us that TCI midwife, and we're running with it to ensure that we permeate all the nooks and crannies of our society with the right information. Of course, we've also been able, with the support of TCI, to set up an SBCC TWG, and that helped us in such a way, because before now, every program has an SBCC component. But our journey with TCI showed us that it's unwieldy to have 10 programs having 10 SBCC. Why don't we have one common SBCC platform where everybody will bring to the table their various influences? And that has helped us also in furtherance communication and behavior change among the society. Also have the RMNCH platform, and of course the media platform. And then lastly, we'll be able to also have an opportunity to have what is called the TCI University, which is a huge resource where we can have a lot of learnings across the space in the reproductive or family health services. And then, of course, this journey, the whole of this has helped us to do two things: increase our modern contraceptive rates, reduce our maternal mortality and under 5 mortality. For me, that is a win for us, and thank you for your attention. Okay, thank you.
So can we appreciate Dr. Ibrahim Alasson? So Dr. Ibrahim Alasson has taken the synopsis of Nasarawa State achievement in partnership with TCI alongside with the remark from the directors. So we have taken care of 2 items here. So let me invite Dr. Mada Absalom, Director of Community and Family Health Services, Nasarawa State Primary Care Development Agency. My good neighbor, you are welcome, sir.
All right, good morning, everyone. If it's still morning, yeah, I guess it still is. So let me start by acknowledging the protocols that have already been established. Of course, our Honorable Commissioner who was here before he left. I will not forget my boss also and the TCI team. I am very excited about today. I remember from what the commissioner said, he said something about having graduated, you should get a job for the graduate. But I wish he was here to hear what I'm about to say, that this graduate is one that has a first-class degree. And if you have a first-class degree, these days, in most cases, you are being sought after. And so I will say, with just a little more support, you will find this graduate flying very, very high in the nearest possible future, shortest possible future. Well, I think the Director of Public Health has said a lot about some of the things that I had captured to mention here. I will just go through and say maybe 1 or 2 things a little bit differently with some of those things that he mentioned. The business unusual approach is one thing that I believe will fascinate everyone. I don't think anyone will have an encounter with TCI and fail to mention the business unusual approach. One of the things that it comes with is a challenge fund. And you could hear the director of the Gates Institute speak about how we did with the challenge fund and the way we matched that fund. So I did the calculation. I had one of them say over 500,000 US dollars is actually closer to 700,000 US dollars. And if you do the math, you know that that is not very small in terms of Naira. And all of these we're able to do because of the kind of support that we have. The support from the Ministry of Health is very, 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 very huge. We have a lot of support from our boss. He did a lot of things, you know, that even at some point, I also did not expect some of the things he did. But it all added up, you know, to bring us to the place where we are. And it helped us, you know, to match the challenge fund that TCI brought. The 72-hour clinic makeover was something that caught my attention when we went to Bauchi. I'm sure Dr. Deborah will remember, the state program coordinator, that having spoken to us about how Bauchi were doing well, you know, I just spoke to our boss and said, well, they told us that Bauchi is doing very well. And if we also want to do well, I think we should also go there, take a look. We had a very large team that went to Bauchi. In our team, we had the director of public health. I was also there. We had the director, health education, social mobilization. We had the person that spoke for the media. He was also with us, and a host of others. And the 72-hour clinic makeover actually really caught my attention because we are all about quality, and you cannot have quality in a space that is not befitting. So the 72-hour clinic makeover helps you to provide that befitting space. And what you see after the 72-hour clinic makeover is you just see the numbers jumping up. That's what has happened with us. So we had TCI do this in 2 facilities, one in Kiana, one in Karo. We also matched TCI. We wish we could have done better. The plan was for us to do 4 and for TCI to do 2. We could not achieve that, but I don't think it's a plan that we have dropped. So our chief executive is here and he's hearing me and he's a man of action. I don't think he has forgotten that we had these 2 other outstanding facilities, Shabu and Adogi, to also add to that number. So TCI did the makeover in PAC Amiri in Kiana and also PAC Masaka in Karo, while we did PAC Kadarko and also PAC Karo in Karo LGA. So the good thing about this is the numbers just kept jumping up. Today in our midst, we have a service provider from PAC Karo. I don't know if she's here. Blessing. Is she here? Okay, she's on her way. She's coming from Karo. She was also in the video speaking. And one good thing that makes me happy is we had, is it Jessica that came from your Baltimore office? She came to visit. And when she went to that facility, she was super impressed. I made a plan to meet up with her in Abuja, and we had discussion for maybe close to 2 hours. She was very ecstatic. She was, I don't even know the words to use, but she was very impressed with that lady and the work that we were doing. So afterwards, when I was told that I was supposed to be on a webinar, the World Cities Day webinar, I was like, this girl may have influenced it because of what she saw and what I told her about what we are doing. So for us, we are very happy. We think most of the things that TCI has done, we can sustain. I actually think so. In fact, there are things that we mentioned to Rotimi, Deborah, that I think we are surpassing in terms of data. So in terms of data, we mentioned that we have some areas where we want to strengthen data at the health facility level, ward level, and also at the LGA level. But I can tell you, even at the health facility level, we have added to the list of things that we want to do to improve data. So we can only see our data go up. I remember very clearly on a particular day that Deborah came to my office with some of our staff. And one thing she mentioned is she has found out that in most of our facilities, when they visited, they found data in the facility much higher than what is reported on the DHIS2. And that kicked up something in my head. And we started looking, more closely at those things that we can do to improve data. Why data? Because I tell people every day, I work very hard. I do. And the only thing that proves I'm working is the data. If I work very hard and the data keeps going down, then I'm not working. So thankfully, the data has been going up, and we think we can still keep improving on this. The SBC-TWG, which the DPH mentioned earlier on, before it became SBC-TWG, it was called SOMTEC. And I would say it was not very active. Most of the work done there, to a large extent, I put myself on the line to make sure that it was working. But see, thankfully, when TCI came, it metamorphosed to SBC-TWG, which is a wider coverage than just social mobilization. This is social behavioral change. So you are not just providing social mobilization, you're also looking at what the impact of that mobilization will be, which is the change in behavior of our people. So I am particularly very, very happy about that. The adolescent TWG was also strengthened with the input of TCI. I think it was not mentioned earlier on, maybe in the documentary or anyone else, but there is something that happened at the adolescent TWG that resulted in us making up our minds to identify family planning and adolescent health champions and also ambassadors. That came, with the support of TCI, and we were able to decorate a number of them. And we believe that that is adding up to the things that will help our system. I see that the MC is coming up to take his space. But there's so much. So apart from what we have also gained from TCI, I'm also here to tell the audience here that TCI also gained a few things from us. One of them is an office space. And then also, there are times when their team needs to go out and, better vehicles needed to be used, and their vehicles were available to take them, for those supportive supervisory visits. So thank you, TCI. Like I said earlier, with a little more TA, you will find this your first class graduate flying very high. Thank you very much.
Okay, thank you, distinguished ladies and gentlemen. Dr. Mada has a lot to say, but because of time, please, my brother, we are twins brother with Dr. Mada. Yes. The only thing that he called me Mr. Dogo, and I call him Mr. Dogo too. Thank you, Dr. Mada. Yes. Okay, let me go to the next item. I will now invite the Executive Secretary of Self Primary Care Development Agency, Dr. Osman Muhammad Adis, to take the next item, which is statement of commitment on sustainability. However, before he comes on, Dr. Muhammad Adis, he has two caps, one as the Executive Secretary. The second cap is also to present presentation of award on behalf of the Honorable Commissioner. You're welcome, sir.
Good morning, the Honorable Commissioner, ably represented by my younger brother, the DPH of State Ministry of Health, the Permanent Secretary in absentia, the team lead the the team lead of TCI, other members of this delegation, directors of the State Ministry of Health and Nasarawa State Primary Economic Agency. I think my job is just very simple, just to make a statement of commitment on behalf of the government of Nasarawa State. But before then, I think one of those things I think this year I've gained from Nasarawa State is, aside from the office space, you might have an office space, but the neighborly environment is hostile. That office, I'm sure, even with the AC, you'll be sweating. I think topmost, what I see as the most important gains of TCI from Nasarawa State is providing that enabling environment and that partnership, positive partnership, because you may have a negative partnership. I think that is apt and top notch. They have enumerated a lot of things that will benefited from TCI and what is expected of the graduates, or that's we, the graduates. I kept saying many times, I look at capacity building as a seed and fertilizer for anybody that takes it very seriously. Because most of us are graduates from either secondary, either colleges of health technology or university or polytechnic. The certificate or the certification has been given. But many a times you hardly can see where you are seeking for job from partners, donors, or development words where they lay emphasis on certificates. Emphasis is on experience. And most importantly, that is what Nasarawa State citizens have gotten from TCI. So I want to say thank you for giving us that experience and for that capacity building. And during the talk around the sustainability of TCI in Nasarawa State, for me, what I feel is number one on the sustainability list is the fact that family planning is able to get a space within our budget line and budget codes. Without a budget line, without government agreeing to have a budget line for family planning, whatever you want to sustain cannot be sustained. So I want to say thank you, Nasarawa State government. I want to thank you, His Excellency, for agreeing to have a push for family planning. That's to say we can raise memos for family planning activity in Nasarawa State. And also, my brother has told you a lot of things about what we've gained around family planning. I think another very important thing that I think the TCI has done is the individual and family empowerment in terms of knowledge, because the Director of Social Mobilization has talked about the issue of beliefs, norms, cultures within our society. If that commitment, if that work was not able to overcome those cultural norms, I think even if we ease out or graduate today, we are going to go back to status quo. And that's what I feel we had overcome. And I want to say thank you to TCI. Coming to the issue of commitment or statement of commitment on behalf of Nasarawa State government, I want to say Nasarawa State government is steadfast in its commitment to ensuring the well-being of its citizens through sustained support of family planning initiatives. The government of Nasarawa State, through the leadership of Engineer A. Isuli, has prioritized accessibility and comprehensive reproductive health services in the state. And we will continue to empower. When I say we, It's not me, it's Engineer A. is Philip. We will continue to empower individuals and families to make informed choices. The statement of commitment is a reflection of the government dedication to promotion of population health, gender equality, and the overall development of our nation, our country, Nigeria. I want to also, at this end, thank the TCI for using the state structure, because before the coming of TCI, the tradition is most partners, most technical supports that we get come with their structure. But TCI adapting the structure of Nasarawa state government will ease the sustainability, because there is no need for you to create gaps. And Dr. Madawadi talked about the issue of data, MIE capacity building. I want to inform us that, because some of us are aware and some of us are not aware, so let it be a take home for TCI to tell you that we are ready as a state to provide more fertile land for you to come and invest. Nasarawa state government has given the primary healthcare development agency the approval to absorb some of our volunteers, which has been your concern, because across the state, we have a lot of workers that have been working for ages and years, and they are not on payroll. But I want to stand before you today that so far in the last 4 months, the government has absorbed 850 state health workers into the payroll. So I say kudos to Nasarawa state government. So as an agency that like taking advantage of opportunities that come our way, what we are doing is to identify among the health information management officers those that are computer literate, that are conversant with the system, train them so that we can use them in the various local government and possible wards, so that at least that will go a long way to improve our data in the state. And I also want to inform you that in the last 1 month, through the impact projects and the basic care provision fund, there is no facility that is a basic care provision facility which will have minimum of 147 industries that don't have Android phone. And this is being done to ensure that our data is improved. So what is left for us is to close those gaps in terms of training on how to use these Androids in using some specialized software, so that we can improve our data collection. Because with good data, we can take an informed decision. So thank you on behalf of Nasarawa state government. And I will say that this wouldn't have been possible without teamwork. Thank you for the support that you've given the management of Nasarawa State Primary Emergency, the Ministry of Health, and Nasarawa State government. Thank you very much, and congratulations to us, all of us.
Okay. Thank you, the Executive Secretary. He spoke on behalf of the Nasarawa State Primary Care Development Agency. Now he will speak on behalf of the Honorable Commissioner, Minister of Health. So the next item is presentation of award. So the Executive Secretary, the Honorable Commissioner will now present awards to the awardees. I don't know whether the awardees are ready. TCI? TCI, okay. Madam. Okay. Okay. Let me invite Dr. Johnson to come for the outcome. Yeah.
On behalf of the Challenge Initiative, would like to present this plaque to the Honorable Governor of the Nasarawa State for his leadership role in ensuring the project, this partnership was a success. Thank you so much, sir.
Thank you very much. I think for a moment, I am the governor of Nasarawa State. So on behalf of the governor of Nasarawa State, I received this award, and I dedicate it to the good people of Nasarawa State who have worked tirelessly to ensure that our family are healthy in every nook and cranny of Nasarawa State. Thank you.
Okay, sir. On behalf of the Challenge Initiative Nigeria, we also like to recognize the role of the Nasarawa State Ministry of Health for contributions to the family planning program in Nasarawa State. So once again,
The governor, I'm not the ministry.
okay, so this next award goes to National State Hospital Management Board. So on behalf of the Challenge Initiative, on behalf of the Challenge Initiative, we'd like to provide this certificate of recognition to the National State Hospital Management Board for their contribution to family planning program in Nasarawa State. Thank you so much, sir. This next award goes to the Nasarawa State Primary Healthcare Development Agency. So once again, we're on behalf of the Challenge Initiative Nigeria, this is to this certificate of recognition is for the Nasarawa State Primary Healthcare Development Agency for your contribution towards the success of family planning project in Nasarawa State. Thank you very much, sir. Okay, sir. Once again, we would like to, on behalf of the Challenge Initiative, we would like to thank the Honorary Commissioner for Health for his immense contribution and support to family planning and reproductive health programs in Nasarawa State. Thank you, sir. Okay. With deepest appreciation, we also like to thank the Permanent Secretary for her immense contribution and support to family planning and reproductive health in Nasarawa State. This is for the Permanent Secretary. Okay. Okay. With deepest appreciation, once again, we'd like to thank the Executive Secretary, National State Primary Healthcare Development Agency, for his immeasurable contribution and support to family planning and reproductive health in Nasarawa State.
Okay, thank you, Dr. Johnson. You may take your seat while the Honorable Commissioner stays behind for the order of this. One is for the Interfaith Forum, see here present. Interfaith. Representative of Interfaith. Okay. The next one, SBCC should get ready. SBCCTWG. The next, adolescent health TWG. The next, media forum. Media forum. The next one, advocacy working group. Party. Advocacy next. Okay. Okay, so he's going to open. Okay. The next one is for the directors, Dr. Ibrahim Adamu Al Hassan. The next one, my brother and my twin brother, Dr. Absalom Madawa. The next one, Director of Nursing Services, Mrs. Patricia Sears. The next one, Mrs. Maria Musliman. Maria Musliman. The next one is Dr. Pharmacist Danjuma Oyinaka Baba. The next one, Mr. Muhammad Abubakar Ibrahim. Thank you. Okay, last but not least, Dr. Stephen Saseto. Anybody from DPR's department? So the Honorable Commissioner, you may take your leave. At the instance of the Honorable Commissioner, distinguished ladies and gentlemen, may we invite Dr. Ibrahim Adamu Alassan to continue from where the Honorable Commissioner stopped. We have certificate of recognition awarded to one, Mrs. Salome Vincent Aya. The next awardees follows Mrs. Fatima Adamu Shuaibu, Mrs. Mildred Morgan, Pharmacist Ezekiel Medawa, Pharmacist Ezekiel Medawa, he or any other person can represent him. The next person is Blessing Ibrahim Ajab Agbaja. If she's here, or her representative, please. Mrs. Blessing. The next person is Mr. Ove Abun Daga. The next person, Mr. Solomon James. The next person, Mr. Sunday Amos Panja. The last but not the least, Mr. Audu Koku. Okay. So Mrs. Blessing Evrem Agbaja, she's not here. Then you may take Louisa. Thank you. Okay, let me also invite Dr. Absalom Madawa again for the next category of awardees. The first in this, let me invite my boss, Mr. Ishaya Amegwa, the State Health Education Officer. Also, let me invite the chief priest of the State Primary Care Agency, Mr. Paul Nyerere, because data is Paul Nyerere. It's not here. Okay, the next person is Mr. Isaac Ephraim. Is here. Mr. Isaac Ephraim. The next person we have in our list is Mrs. Magdalene Dominic. This is here or her representative. The next, my junior boss again, Mr. Ismail Ogande. If he's not here, then I'll invite Ishaya Amegwa to come over. The next person is Miss Fatima Usman. Fatima Usman Kande, that's our third name, but she's not here. Fatima Usman, she's not here. Okay. The next person is Mrs. Esther Iona. She's here. The next person is Mr. Osiki M. Omame, the chairman of the forum of MIE Nasarawa State. The next person is Mr. Abraham Asule. Abraham Asule is not here. The next person is Mrs. Aisha Abisabo. She's not here. The next person, Mr. Jimmy Ben, is here. The last but not the least in this category is Mr. Ibrahim Bauri. He's also not here. So thank you, Dr. Amada, for that. Can we appreciate ourselves, distinguished ladies and gentlemen? We'll now move to the next item in our agenda, which is the launch has been taken off. The group picture also has been taken off, right? Then vote of thanks. You know, according to communication expert, there is nothing permanent except change. So in that regard, we have little change in our agenda, which the vote of thanks supposed to be taken by reproductive health coordinator. But at the instance of the Honorable Commissioner, I will now invite the Director of Nursing Services to give us the vote of thanks. Okay. Sorry. Okay. Okay. Sorry, madam. The Honorable Commissioner, the TCI. How many of us are supposed to have? Okay. Sorry. Okay. I will invite okay. Okay, the next item, which is silently captured in our agenda, but you cannot see it with your naked eyes, which is the cutting of cake. I will invite the Honorable Commissioner, the TCI, the representative of Chief Medical Director, Director of Pharmaceutical Services, the DNS, the Adolescent Working Core Group, the SBCC, to come forward for the cutting of cake. Okay. Okay. Count of three. Are we ready? 1, 2, 3. Thank you, thank you, thank you, thank you. Yes. Thank you, the Honorable Commissioner, the Executive Secretary, Directors, TCI, for your wonderful times. So the next item again is group picture. Okay. Let me also, again, there is this common saying that one good thing deserves another. The state has received awards. So the State Primary Health Care Development Agency, under the leadership of our Institute leader, Dr. Usman Mahmoud Aziz, has also some line of award to be given to TCI. So let me also invite the Executive Secretary and the TCI team lead to come forward for the receipt. Okay, Dr. Madam. Okay. Okay, the first, okay. Okay, the first in the list is Dr. Taiwo Johnson.
So thank you on behalf of Nasarawa State Government. This is saying thank you for the partnership.
Okay. Thank you. Also, let me invite Dorcas Akila, my best facilitator of the year. She taught me how to write compelling memo. Compelling, that's our common word. Compelling memo. You're welcome, man. Thank you. Dokasaki.
On behalf of Nasarawa State government, thank you very much for the partnership.
Okay, let me also invite Dr. Olunkule Omotosho, my facilitator. The next person here is Mr. Odwak Ananaba, Mrs. Odwak Ananaba, if she's here, or her representative. The next person is Sifon Bonk Ata. Bear with me for mentioning your name. Sorry. So the next person is Opanacha Ichapi. Opanachi Ichapi. The next person is Dr. Victor Igaro. Dr. Victor Igaro. The next person is Dr. Deborah Tony Ka. The next person is Mr. Oluwafoshun Daniel.
I don't understand why people clapping for Deborah. I non-stop clapping. Oh, she's our own. Okay. The Deborah we know.
Mr. Oluwafonshun is okay. Mr. Rotimi, sir. Daniel. Okay, the next person again is Olufemi Timothy Rotimi. The next person is Enibong Ekot. Enibong. Thank you. So, okay, you may take that. So you may take your, can we appreciate the State Primary Healthcare Development Agency? So the next item is group picture. Can we come over, so outside? Can we go outside for the group picture? Come. Okay, let us do it here. When branching. Okay. everybody. If you are not only you need my assistant, please let me know. You can come over. Okay, thank you. How say there is provision? Okay, provision for interview. Interview. Okay, can we take our seats, distinguished ladies and gentlemen? Sorry. Okay, distinguished ladies and gentlemen, we are gradually and very importantly moving to the concluding part of this exercise. So let me invite okay, let me invite distinct. Let me invite the Director of Nursing Services to give us a vote of thanks. And before then, there is provision for lunch. The directors and other distinguished personalities, members of the high table, lunch has been arranged for you at the restaurant here. So you can go to restaurant and take your lunch. And some of us, our lunch is also already outside. So let me invite the Director of Nursing Services. Okay, sorry.
Thank you so much. I want to thank everybody, especially the barrier breakers. I want to thank the TCI as barrier breakers. For one, to impact a life is about excellence. It's about excellence. It's about why I'm saying this thing is this. I want to thank you once more from the Hospital Management Board on behalf of our CMD, Dr. Ogbe. I want to appreciate you because the CTI, they have, in the program, they are able to include about 7 of our hospitals. And in these 7 hospitals, whenever we go for our IQSS, in short, their own way of handling family planning is different. And I can see that through the impactation, there is reduced reproductive health, there is reduced complications in reproductive health. Why I'm saying this thing is this. Initially, there was nothing before the onset of TCI. There was no documentation in the hospital. And then mentoring was not just too strong. But when they come in, there was strengthening there. So I want to thank you so much for what you have done. All we are crying is that if other hospitals would have included, I think it will be of how will I say, a plus to us. Because those hospitals that were involved in the program, they are doing very well in terms of family planning. So when we went last week for supervision, one of the hospital, when I was communicating to the personnel there, I can see difference. She was talking of going for outreach. I said, family planning, outreach. I didn't know that she was impacted. There was something in her that has come up that she wants to use it. So we want to thank you so much on behalf of Hospital Management Board. We thank you, the organizers. We thank you, the team. I meant to understand that it's not only the TCI, but there are other teams. We want to thank you so much. We thank the Primary Health Care Agency. We thank Ministry of Health, Nasarawa State. We thank our governor. We thank for partnership with the right people that will change the mentality, the barrier breaker. I call it barrier breaker. Why? Because there are some mentality in us that through the impactation, it is broken. So I want to thank you so much. I wish all of us goodwill. This is a goodwill from our CMD, Dr. Ogbe. We wish you well, TIC, Nasarawa State, and all those that partake in this program. Thank you so much. God bless you.
Thank you, the Director, Nursing Services, for this wonderful vote of thanks. Can we appreciate the Nasarawa State government for giving us the level playing ground? The TCI for supporting Nasarawa State. Can we appreciate the TCI as well? So, distinguished ladies and gentlemen, we will draw our curtain from this part of from this activity. Then we will now be on our feet to observe second nation stanza as our closing prayers again. Then after the count of 3, 1, 2, 3, go. Oh God of creation. Thank you, thank you, thank you, thank you, thank you. Then there will be stakeholders interview with the media. So the Honorable Commissioner, other stakeholders which have been identified by the media. Thank you and God bless you all.
Prior to TCI intervention regarding issue of family planning and child spacing, the attention on capacity building, the attention of bringing a partner that will use the state structure was not actually in place.
We consider family planning as a very, very important intervention, particularly because we know that any society that is desirous of reducing maternal mortality must take family planning very seriously.
Family planning has a lot of impacts on myself and my family. Most especially, it allows me to cater for my family and for the next conception.
In the past, programs just come into the States, IPs come and say, okay, they want to work with us and, we start. But the first difference I saw with the theory is that you're actually supposed to submit an expression of interest. And so I led that process. We wrote that letter of expression of interest to show that we even want to work, with the TCI team.
With TCI support, we've been able to unravel a lot of flaws that we had with our data system. We have put in place